keep it quick. I'm not going to summarize it because as a debate, I'm supposed to say what is against pregabalin and gabapentin. And we know as pain specialists, as neurosurgeons, we have been using pregabalin right, left, and center. Every patient, we don't even write crocin or paracetamol nowadays. We first write pregabalin, and most of the time we find out the patient's already receiving it from the previous doctor. So we increase the dose because there is no other drug. Anything beyond pregabalin becomes actually an opioid like a morphine or a tramadol. There is nothing between them. And unfortunately, we are not very well aware of the side effects. We have been so much industry driven that we have in a way turned a blind eye to potentially fatal complications which these drugs can have. And it is not a small, I would say, kaleidoscope. It is a full array of complications which are not existing. Rajiv said there is a very low complication rate. Actually, complication rate is extremely high. Extremely high. Dizziness, almost every patient will have dizziness. We all know that. And one of the most common things, I think, which the books don't sell, we should start at a very low dose. In fact, in elderly patients which are 60 years above, you should start at 25 mg. And 25 mg pregabalin is available in the market. But we never prescribe it. It is not to be, in children, it is not indicated only because there are no studies, it is contraindicated in children. So why have they made 25 mg? It is for only this reason that you have to start at a very low dose and gradually, because elderly patients, sometimes they will go into a kind of stupor if you give this. Also, common complaint is it's like you are drunk, very high. And actually it makes you feel that. It's a dose dependent side effect. Normally what has been given in books is you can give easily up to 600 milligrams a day. That is the standard dose of pregabalin. We never give that high dose. We usually go up to 150, maximum 300 mg. But in books it's given, and people, once they get addicted to it, go up to 3000 milligrams per day. So 3000, 6000 they can take, because chances of dying is very low, as Dr. Rajiv rightly said. But the high, because patients get tolerant to the drug, so they keep taking higher and higher doses. And it gives you the same high as alcohol. Cardiac causes are very important, and especially for the large number of patients who have blood pressure, congestive heart failure, some other thing, we never take the history. Peripheral edema, which we see, we disregarded. Patients come with swollen, feet, which we can't understand. And PR interval, which is recorded, and I'll tell you why we should be doing all this. Psychiatric, obviously, as I said, psychiatric and neurological complications intermix. And when I say common, it is up to 10%. And very common means more than 10%. Immunologic complications, nobody talks about it, very common. So of infection increase. Any patient you're giving pregabalin, chances of getting any kind of infection will increase dramatically. In fact, if a patient is having some infection and give pregabalin, more chances of going to sepsis or something like that. Urinary complications, common. Ocular complication, I think Rajiv also touched upon it, but you have to understand visual field defects, very common. 10% or more will have visual field changes. Nobody knows why, but they will have changes. Common is blurry vision, abnormal vision. We consider, we don't even think about it, but patients are, this is a common complication reported. Chest complications are also been reported to be common. We are giving it for pain, but again, this is a drug which can also cause pain. One of the most feared complications, dermatological complications, angioedema is reported. Swelling, as I said, they can have a very innocuous like swelling in the feet, but it can progress to angioedema, which can go into something akin to anaphylactic reactions, and there have been deaths. So it is not that it's not fatal. They have been, and if you are predisposed, God forbid, if you're predisposed, we never take the history. If you're predisposed to any kind of angioedema because of any other cause, this can prove the last straw in killing you off. That is why what has been actually suggested is You should have for every patient a standard ECG to make sure what is the PR interval. You should have an eye examination, because if the visual field changes, we can never document unless you have a baseline examination. You should have a platelet count, because bleeding, as a neurosurgeon, we all are so aware that bleeding problem should be there or not there. Aspirin somebody is taking, we stop all surgeries on that patient, but we hardly bother about pregabalin, and it has been known to cause platelet dysfunction, and it should not be given in those patients in which you're thinking of getting operated. Also, it increases serum creatinine kinase because of rhabdomyolysis, and we should be monitoring that, especially in those patients which are prone to it. In fact, the complications have been so much that FDA had issued an alert some time back, and that alert in India specifically sent an alert to the government that India is one of the countries which is freely giving this drug. Most of the countries have made it, as Dr. Rajiv said, a controlled substance, a Schedule 5 drug. It's almost at the level of morphine. So imagine any country, be it US, be it UK, be it Australia, it is considered same as morphine. You cannot take it out from anywhere. And only in India it is given like crocin or any other drug. And that is why the abuse has started. And in India, you know, if the abuse starts, where it starts from? Punjab. So already papers are studied coming out from Punjab for pregabalin abuse. It is being sold. In fact, there was a crackdown. There was a newspaper report, there was a crackdown. They caught tons of pregabalin being supplied. Pharma companies are doing it. So it is now, it is legally available, almost like off the counter drug, and people are enjoying. It gives you the high. Why should they not take it? Taking 600 milligrams will make you like you're taking a peg of rum. Today all you will be having maybe. So quickly to conclude, see, I can tell you my experience, but doesn't want to stop it. I write, my staff and everybody says, what does Dr. Deepak do? He only writes pregabalin. Because any patient with back pain, any patient, any kind, first drug you write is pregabalin. They don't understand at the back end, there is so much of things you're thinking when you're writing pregabalin, when you're stopping, how much you're writing, how much you should give. And I think this lot of quackery is also going on, because everybody knows that pregabalin will make you feel high, will make you feel euphoric, will obviously affect the pain. So that sense of safety profile, which we should be as neurosurgeons, pain specialists, we should be aware of. That is, if we are at 50%, other people beyond our community at 0%. So that is, we should be cognizant, and we should do responsibly our duties in terms of prescription. And bottom line is the minimum possible. That is true for every drug, more so for this drug, especially because the government controls are so lax in this country. It should be the minimum possible dose and for the minimum possible period. Thank you so much.